A hearty good afternoon to everyone, and welcome to our session on the topic of the Autism Spectrum Disorder. We are pleased to have Dr. Prachi Bhosal among us to educate us on this topic. Dr. Prachi is an experienced pediatrician with Apollo Cradle and Children's Hospital with a deep understanding of developmental pediatrics. And we are pleased to have her on as our esteemed guest to shed some light on the topic. Doctor, you have the stage.
Hi, hi all. Good afternoon. So I'm Dr. Prachi Bhosal. Thanks for introduction. Working in Apollo Cradle Hospital, Brookfield. So as everybody of us, we know that 2nd April is a World Awareness Day about autism. So that is why I would like to discuss about autism, ASD, that is Autism Spectrum Disorder, in detail, because we have to understand what is the condition and how frequently it is happening. Because recently in last 2 years I have seen many kids who are coming to the OPD saying that baby is not able to speak, baby is not responding. In this COVID time pandemic, the number of cases of autism I have seen many more in my OPD. So that is why I would like to discuss that in detail. So, what is autism? So, autism is a developmental disorder characterized by qualitative impairment in reciprocal social interaction and social behavior. So, like the word autism is auto. So, what is auto is self. So, baby is liking to be in his self environment. That means baby wants to enjoy, to play, to everything he wants to do alone. Lone playing, normally what we say. So they don't bother who is there around them, who is there in front of their mother, father, friend, sibling, grandparent. They just want to play alone. So they do. That is why the word self, autism. So that word correctly describes the autism. So in autism, it has other features of autism will be there will be restrictive, repetitive, and stereotype pattern of behavior. Like baby will be like to do some particular things which they keep on continuing again and again and again in the same and repetitive fashion. If they get any change in their normal routine life or normal routine, their normal routine also get disturbed, they get agitated, they get irritated, and they throw temper tantrum. So normally that is why they will be liking in the same house. If they change their house to some other house, or if they go to meet somebody else, and if they find somebody some change in their environment, they will start crying. All of a sudden they'll start smiling. They have some different things. So anyways, I would like to discuss that in details. So and one more thing we have to discuss about them is they have unusual responses to the sensory experiences and perception. So like what is sensory experiences? Like they will have hyper or hypersensitivity to particular things like pain, temperature, touch, hearing, and vision. Like hypo or hyper, like if at all they have if I try to touch that baby, or else if the parents will complain, if I try to cuddle the baby, baby will not like that. They will try to go away from the parents. Or else if they are hearing some kind of whistle, or else cooker sound, or else if they hear fan sound which we are normally hearing, but if they are able to hear, if they hear, and they will become irritated, and they will start putting their hands inside on their head, so that they will get very much irritated because of that sound. So that is called as hypersensitivity to the sound. So hearing, so it is the developmental disorders that occurs in first 3 years of life, and it affects the brain's normal development and social and communication behavior. So that is very important. It affects the child's social and communication behavior. That is why we have to deal with this kid as early as possible. So the why we are talking too much about autism, because recently, as I told you, the prevalence has doubled. The prevalence of this autistic babies which we see this year, this last decade, it has increased. And why it has increased? Because of new development of diagnostic tools, and we are monitoring increase has increased. That is why the number of cases number of cases which are identified, diagnosed, are increased. So apparently, normally you will see the baby will be normally looking. Apparently, the baby will be looking absolutely normal, but the skills are not functioning, like social skill, some motor functioning, some gross motor functioning, they are not working. So looking wise, baby will be absolutely fine. The parents will say he is absolutely fine, my kid is normal. But when you keep on observing the baby for a long period of time, or else if you keep on checking the particular activities what he's doing the day by day, slowly we get to know. So that is why when the baby comes in our OPD, I normally we have to keep our eyes and ears open, and we have to always, whatever mother says, I have to answer the mother. I will always take the mother's effects positive, as a positive way, because mother will tell my baby does all these things, in between. My baby does has done last time like this, or is my baby has learned few words, now he is not speaking. So this kind of words, this kind of small things we have to catch whenever mother comes for the vaccination visit. And we have to start uh, all this surveillance, what we call it, we have to keep on checking all these babies normal developmental behavior, starting from 6 months till 14 months, because that is the time, there are very subtle signs which are occurring in between babies, which we can just keep on observing. And then if as early as possible, if we make the diagnosis, the interventions we start earlier, the outcome is very good. So the diagnosis is, as I told you, the diagnosis initially is not only clinically, but we have to do the suspicion. If mothers or father has slight suspicion also, we have to go ahead and do the investigation. There are some certain tools which we have to go ahead and do that. I will tell you about in future, recent time. So what are the core clinical features? Okay, that is very important thing. So core clinical features is non-verbal communication, verbal communication, and social relationship. So what are non-verbal communications? Like at the age of 9 months, babies will be trying to say bye bye, high five, clap clap. So this, if I tell to the normal kid, baby will try to look into my eyes. Eye to eye contact will be there, which starts developing by the age of 2 to 3 months. Normal babies will do that by 2 to 3 months, but autistic babies will not have that problem. They will not do this. They will be not have eye contact at all. They will be looking, whenever they enter in the room, they will be looking somewhere else, or else they will be in their own world. They will not at all look their parents also. They don't have sometimes stranger anxiety, or else they will be sometimes so friendly, they will come to you, but they don't have insight. They will not talk to you, or they will just keep on playing with you as a stranger. So non-verbal communication is not there, like eye to eye contact, social smile, gesture, or as if I say hi, come, baby will not at all look at me. So all these symptoms, actually these gestures are very important, starting from the age of 6 months, because by the age of 6 months, normally babies will try to communicate to the parents or caregiver through the language of gestures, which doesn't develop. Second is verbal communication. So verbal communication is like baby will start saying at least mama, papa, or else in their own language they will try to talk to parents, and they will try to start communication with the parents in their own language, which parents also understand. Like in amma, he is calling me amma, he is calling me akka, and that too he understands, and he doesn't keep on calling amma to everybody. He calls amma only to his mama, he calls papa only to his father. So they do understand the relation, and they will start making communication. That is also very absent in autistic babies. And social relationship, as I told you, they don't understand who is there next to them. They will keep on playing without making any difference that somebody is there in that same room or nobody is there. They keep on playing, and that activities are also same. Particularly, they will keep on putting the objects in the toy, in one basket, again they will put it down, again they will put it inside, again they will put it out. Normally, if you ask them, have does your if you ask the parents, does your baby has put your all the toys out of the window continuously? Yes, the history will be yes. Then sometimes if you ask that if the baby is trying to toe walking, has your baby has tried to walk toe walking, the parents will say yes. Don't talk, don't we have to ask some leading questions, so that sometimes if it has happened, yes, parents says yes, I have seen this kind of thing. Because why they do toe walking? Sometimes because once they have hypersensitivity of the sensory stimulation, they get something different taste of somewhere of the some part of the floor, and they walk toe walking. So this is a typical different feature which is seen in autistic babies. So how we have to why we have to screen Why we have to screen all the babies? As I told you, because the number of affected kids of the autism, they are increasing. 1 in 68 kids are getting affected because of this, and the boys are more affected than girls, like 4 times more than girls. So 5 lakhs children are less than 15 years are autistic in India, more than 5 lakhs. That is the recent calculation which we have seen recent. So we have to start the early diagnosis, early intervention, and which can give us better development outcome and reduce the cost of care. It can also, initially we used to say the autism can be diagnosed as early as 3 years only, but recent, because so many diagnostic measures have developed nicely, we are able to diagnose that by as early as starting from 6 months to 12 months also. Okay, so what are the main disabilities? So I would like to go ahead in the main details again, that what are the main disabilities which are occurring in the autism ASD. So in ASD, normally we will see that speech and language delay will be there. Movement, as I told you, movement will be again and again stereotype and repetitive and restrictive type of movements. Like baby will be rocking, continuously rocking the chair, either like this, or else they'll be rocking from right to left, right to left, left to right. They'll keep on doing this movement continuously, or they'll keep on spinning their hands continuously. They'll keep on flapping their hands. That kind of repetitive movements will be there. They'll be walking on toes, as I told you, and they will have some clumsy gait. They will have grimace, like they'll keep on doing their body like this. They'll keep on doing stretching their mouth like this, and they will be having that grimace kind of thing. They will keep on babbling continuously something, but it is doesn't make any meaningful gesture out of it. They'll keep on babbling unnecessary by the age of 1 year. They will always think and behave uh, inflexible. Some children's, the very important thing in the autistic babies is regression. So what is regression? So regression is the thing in which babies, they will, mothers and parents will tell that baby used to speak mama, papa, or he used to give us social smile, or he used to say tata bye bye by the age of 14 months, 15 months. But all of a sudden, since last 2 to 3 months, he has stopped doing all the activities. So that is regression. So whatever developmental milestone baby has achieved, he will try to, he has forgotten in last 2 to 3 months. That is the regression, and that is the red flag sign. What we say, red flag sign of the autism. So if you see, if the baby has this kind of problem, it is the surely red flag sign of the autism. So please try to always observe your kid whether he has this kind of problems on and off in his life. Then we also have to how we'll diagnose the kid. So for diagnosing, because ASD has variety of developmental delay, social, emotional, and cognitive. So we have to develop the different pace. If your child is not meeting the milestone for his or her age, then you have to suspect a problem, and we have to share it with your doctors. If you have to, and sometimes parents will come and they will ask us, baby's father has not spoken for 2 to 3 years. His normal, that is normal. Baby's younger elder sibling has not spoken for 4 years, so can we wait? If the baby has not spoken at least till 2 years also, can we wait? But I will strongly suggest that please try to avoid so wait and watch phenomenon. If you say that baby waiting is okay, or else let's wait for up to 3 years, let's whether the baby is able to speak or no, or whether the baby is stimulating or no by the age of 3 months, 3 years, this is not at all acceptable behavior. So please try to avoid that one. Whenever the parents comes as a immediately, we have to take a action immediately, so that as early as, because our brain is very neuroflexible, neuroplasticity, what we say, it is very high at the age of 1 year to 3 years. So when we start the action as early as possible, the baby's reaction, baby's development, baby will be more self-learning will be more and more, and then it will be more better for the baby's future. So please don't wait and watch. Whenever you suspect that baby has any problem, immediately come to your nearby pediatrician and please start the treatment as early as possible. Don't wait and watch. So normally we say trust your instincts. We have to keep our eyes and ears open. Whenever you find any normal baby is having some abnormal behavior, immediately you inform to your pediatrician. Then the next thing, we have to see the early signs. How we will see the early sign? That baby will be unable to relate. I told you, unable to relate to the adult and children. He doesn't want to play with others. He is very happy to play with his own. Then he has very poor speech. He doesn't develop speech at all by the age of 2 years also. There is hardly any word or hardly any babbling sound which comes by the age of 2 years. Then he inappropriately, he will keep on laughing or he'll cry all of a sudden without any reason. Like emotional disturbances will be there. Baby in front of everybody, baby will all of a sudden start crying or baby will start laughing. Baby will have hyper or hypo sensitivity to sound. As I told you, baby will keep on putting his hands on his ears. All of a sudden, if he gets scared, if nothing is there, just some whistle comes outside, or his fan sound starts occurring, or else if he sees some kind of this one whistle from the pressure cooker, he will get scared, or his washing machine sound, he'll get scared. So very hyperactive to any sound. He will always, he'll be playing unusual play, normally what we say. So if you give car to the baby, he will start playing with the wheels of the car. He will not play as a normal kid will do. He will start rolling, spinning the wheels of the car. Then he will also like being, he doesn't like, as I told you, he doesn't like, the kids doesn't like to be cuddled. And there will be, they're more sensitive to the touch by 3 months. So normally when the baby comes to our OPD, we see that baby should have eye to eye contact, which develop by 8 weeks. And that should not be only eye to eye contact that baby is just doing and looking somewhere else. That should be having quality and quantity. Like baby should be doing eye to eye contact, and he should be making some purpose out of it. Like he will smile at you after that, always he will have that sustained eye to eye contact for such long small period of time. He will not just look at you and he will look somewhere else. He will have eye to eye contact, and he will try to grasp that who is this new person. He will try to grasp that is he the stranger or he is known to me. So that is important. Social smile, normally also when the baby comes to our OPD for the vaccination, we normally ask whether the baby has social smile. Baby has started smiling to you, which starts developing by 2 to 3 months. Social smile is very, very, very important milestone which develops to all healthy babies. And again, we also see the head holding, then roll over and all things. So that is also very important things which we call. The other thing which happens to the babies which develop by the age of 6 to 10 months is joint attention. So what is joint attention, which is lacking in the autistic babies? So joint attention in this, that baby will, there will be three things over there, like baby, the person like caretaker, and the thing which baby gets attracted or is amused, or baby gets happy to see that object. Like if the baby sees some bird flying in the air, he will try to show it to the caregiver. Either he will look at that object, again he will look at back to his caregiver, again he will look at to that object again. So that is called a joint attention. Like he wants to enjoy the same moment to his parent also, and himself also. So that is called a joint attention. Or if he sees any aeroplane is going on, again he will be happy to show, again he will show. So that normally starts by the age of 6 to 9 months, and slowly he will make sure that he will show it with the of fingers. He will try to show it slowly with the fingers. He will keep on showing the object and enjoy the same moments with the parents also. So that is very, very important. So in the six, right now I would like to discuss about the red flag signs, which are the very, very important things which you see in your baby. Please get corrected by your next pediatrician. Anywhere you can just come back to me. I would like to discuss in detail about your baby if at all you see this kind of symptoms. So what are those symptoms? So by 6 months, if you see there is no big smile, or there is no warm or joyful expression of your baby, it's not at all acceptable. Please get your concerns to your pediatrician. Then by the age of 9 months, if there is no back and forth sharing of sound, or else smiles, or else any other facial expression, as I told you, non-verbal communication. By the age of 9 months, if the baby is not happy to give any communication sign, not only the verbal but non-verbal communication with the parents, it's not at all a good sign. Again, by the age of 12 months, if there is no response to his name, lack of response to the name is very, very abnormal thing by the age of 1 year. So whatever name you are calling by the you are calling to the baby, like if you're calling hi baby, whatever, if your pet name is there or is your real name, but whatever caregiver calls caregiver call to the baby or parents call to the baby will immediately respond. If you call, immediately he turns to that towards the parental voice that somebody is calling me, I have to respond. Then by 12 months there is no baby talk or no babbling sound. That is also not acceptable. Again, there is no back and forth gestures such as pointing, showing, reaching out or waving like high five, bye bye, what I told you, that is not there by 12 months. That is also not good. And there is no single meaningful word by the age of 16 months is high red flag sign. So baby should have at least one word by 16 months. If he doesn't, that means it is not a good sign. Please refer to the nearby pediatrician. Or else the last one, by the age of 24 months, we always expect that a baby should speak two-word sentence. That means give me, I don't want, come here, this kind of two-word sentence, small sentences. They will start speaking to their parents or caregiver. But there is no meaningful two-word sentence phrases which don't involve imitating or repeating. So what do you mean by imitating or repeating? Like if you put on some nursery rhyme and the baby is singing that nursery rhyme again and again, that is not two words phrases. We should say that sound properly, two word sentence proper by understanding. Or as if he's saying some dialogue, like he's listening into the cartoon or else on the TV, if he's listening something and if he's continuously saying that again and again dialogue, that is also not repeat a meaningful word. So I want him to speak some meaningful words. That is very important. Then again, when the babies, this all things we see up to 2 years. Above the age of 2 years, we have to see that the babies will be socially withdrawn. They'll be liking to stay alone. They will keep on playing alone. They don't want to play interactive games with the other kids. Also, they don't want to make any good friends. They want when they'll go to nearby to any new child, they will try to push them away, or else they will run away from them. They also don't respond very well with eye contact or smiles, and almost always avoids the eye contact. They always shows the lack of empathy and prefers to spend time with themselves. So lack of empathy is like whenever the 2-year-old kid sees his old sibling, or else his parents get hurt, or they fall down or something, he will come near and he will say, oh, his expression will be very what happened to you and all things, like he some expression he will keep on showing that he is very much empathetic or he's concerned about your pain. But if the baby is not at all affected with that, he just keep on playing, or else he's going away when you have fallen down, that is lack of empathy. That happens by the age of 2 years. So that is also a big difficult thing. So what are the self-stimulatory behaviors? Because this autistic babies, normally they would like to enjoy themselves by doing some different activities. So what kind of activities they will be doing? So as I told you, hand flipping. They will keep on flapping their hands while running or while sleeping, or as whatever while doing. Rocking back to back, as I told you, spinning in circle. They'll keep on running around in circle again and again, again and again. So if you ask to the parents will say, yeah, he keeps on running around because he has that nursery rhyme, ringa ringa roses. But that is not the case. The babies will, even though there is no nursery rhyme, baby will keep on running around, spinning and spinning and spinning. Then there will be finger flickering. Then they will keep on going head banging. They will not try to sometimes it will be self injurious also. They will keep on doing the head banging. Staring at lights. They'll keep on staring whenever they'll enter in the room. Normally they'll keep on staring at the lights, and their staring will continue for 10 minutes, 15 minutes. Sometimes they'll just enter in the room and they'll keep on playing with the switches on and off, on and off. And they will sometimes they'll keep on playing their movements in front of their eyes, and they'll keep on repeating the words or noises which doesn't have any meaningful words. Meaning they have echolalia, like some word. Now what is echolalia? So echolalia is like sometimes if you see the kids, they will be if you ask parents that is he able to answer you, or is he saying some words properly, the parents will be saying yes, they are saying. But then we ask what kind of words they are saying. So they will be saying, if I ask call mama, he will say call mama. So that is not the meaningful word. Baby should say only mama when he looks only to mama. But when the parents are continuously asking them, say mama, they will always say mama, say mama. Again, if you say them to say like get this, what is this, what is it? They'll just keep on repeating the same question, whatever you are asking. That is called as echolalia. Like they are not understanding the meaning of the word, but they'll keep on repeating again and again. Also their peekaboo, like they will not be doing any imaginative play. Like if you give normal by the age of 9 months or 10 months, babies will take parents comb, they'll start combing by the age of 1 year, 15 months. But these babies will not be able to do. They will not have some kind of imaginative or pretend play. If you give the 1 year old, 15 months old babies, they will take the glass, they will try to sip something from them, either water or milk. They will just keep on doing the activity. If even though there is nothing, but in autistic babies, it will be lacking. They will not be able to do all these things. Then they will be also take the phone and they will say hello, hello. But these babies, they will take the phone, they will throw it. Or else if you give them some object like a spoon or else katori, they will just keep on throwing it. They don't want to keep that particular object, or they don't understand how to make use of it. If you give car, they'll keep on playing with the wheels. That is also the particular this one is there. So normally this kind of activities will be there. Then they will have always short attention span. They will have strong need of sameness. So what is sameness? They will keep on having, they want the every day's routine to be the same. They don't want change of clothes, they don't want change of everyday routine activity. If they want this set of toys, every day they'll keep on putting those toys in the same order. They will not keep on, they don't like if we keep on changing the order of the toys. Or else they don't want, they want the same cloth. Like if you put some cloth, the texture is different, they'll get irritated. So that is why, they want the strong need of sameness, and they have very narrow interest of playing or is doing everything. So they want the particular same toy every day. If that toy is not there, again they will show through the temper tantrum. So, early signs and symptoms, I would like to tell you. There is, as I told you, no babbling at 12 months, no gesturing by 12 months, no single word by 12 months, and no two-word phrases by 12 months or by 24 months, losing any language or social skills at any age. As I told you, regression. So, this is the regression. If they are losing any language or any skills which they have achieved by the age of 16 to 18 months and they have lost, that is called as regression. That is very particular sign of this one, autistic babies. And these children should receive hearing test. We have to go ahead and do the hearing test, and we have to see their tongue also for tongue tie. So whether they have any problem in speaking, that also we have to go ahead and do. Normally they don't require any blood test and all, but yeah, we do the thyroid test in sometimes, and some other screening test which we have to rule out the lead poisoning or something, and we have to check the baby's hemoglobin also. So next thing I would like to discuss is ASD. Normally the kids parents will come, my baby is able to not able to speak only, but he is able to understand what I say. If I say give him some instructions, he will try to follow them. Or as if I tell him go and get this one, switch off the light, get my mobile, get my keys, he will try to follow all the instruction. So does my baby has autism? Because he has not started speaking. So I would like to tell that all the babies who don't speak, they don't have autism. So sometimes they might have only speech delay. So every autistic other baby, some babies we have only speech delays, some babies we have some in this intellectual disability. So 30% of children with ASD have intellectual disorder, 25% of children with ASD have borderline intellectual disorder. So they have social communication is impaired, and they have relative non-verbal skills which are not developed. 30 to 80%, like ADHD, if you have heard about attention deficit hyperactive disorder, so 30 to 80% of the babies have comorbid ADHD. ADHD is in attention deficit hyperactive disorder. So when we are doing the examination of the babies, sometimes the babies might have macrocephaly. So what is the macrocephaly? It is an increased rate of head growth, is found in up to 70% of children with ASD. So always whenever baby comes to our OPD, we normally keep on checking the baby's height, weight and head circumference, because head circumference growth is very, very important. So approximately 1/4 of the children with isolated ASD have head circumference greater than 97 percentile. So always keep a check. If you feel any doubt about this, please give your consent to your pediatrician. Also, we have to this microcephaly in some children of ASD. It is not required for the it is not the only feature for diagnosis, but yes, it might help us for diagnosis. Sometimes autistic babies can have some kind of surveillance, or else they have some comorbidities, like some other problems. So which are those problems? So they might have some seizure disorder, some sleep disorder, some, as I told you, language disorder or learning disabilities, some genetic disorders like Fragile X syndrome or is trisomy 21. They are always having developmental and mental health comorbidities like hyperactivity, depression, anxiety, behavioral regulation. Sometimes they can have sleep problems like late onset, frequent walking, waking up, and restlessness. They also have gastrointestinal, feeding, or nutritional problems, and they delay in acquisition of self-help skills, like they always delay in toileting, self-dressing, and hygiene. So it is important to note that sometimes parents will always tell us that my baby is not abnormal, my baby is normal, he is not having any abnormal things. So we have to tell them that earliest symptoms are absence of normal behavior and is not the presence of abnormal behavior. So parents will not come that my baby is abnormal, but we have to find out that baby has some absence of normal behavior, baby is not behaving normally. That is the thing. Baby doesn't develop any abnormal behavior. If you delay it, maybe by 2 years and 3 years, more and more abnormal behavior will start. But absence of normal behavior is very, very important. So parental concern about the inconsistent hearing, unusual responsiveness is very, very important. As if he's not responding his name by 1 year, that is also to be taken very seriously. Extremes of behavior and temperament ranging from marked irritability and alarming passivity is present in autistic babies. And as I told you, social skills regression is very, very common nowadays. So the other thing I would like to discuss is that what are the high risk factors in children of ADHD? So high risk factors are like if the baby's sibling has autism, or his mother, maternal or paternal age is advanced, or his parental schizophrenia is there, like psychosis or affective disorder, or his mother has any intake of sodium valproate, like mother has any seizure disorder, and if she's already on any medication during pregnancy, that can also has high risk of developing autism. Then fetal alcohol syndrome, that means if mother has taken alcohol during the pregnancy, or is any birth defects are there like CNS malformation, or is any dysfunction including cerebral palsy, or is, as I told you, some neurogenetic disorders like Fragile X, Angelman syndrome, neurocutaneous syndrome, chromosomal anomalies like trisomy 21, neonatal encephalopathy, like at the birth, if the baby has got any kind of encephalopathy, like brain infection, it can cause the high risk, that comes in the high risk babies. Okay, so we have to always observe this one for the diagnosis of autism. And then if at all, if you find out if the baby is having this kind of problem, by 18 months, 16 to 18 months, we start doing ASD specific screening tool. So now what are the ASD specific screening tools? So the main important thing is MChat. There is one MChat, it is available in the format kind of form, online available. It's very easy to get it on the through Google. Just get it, and we have to solve those questionnaires. We have to give it to the parents, and when they come next time, we have to see the score. So if the score is less than 2, normally if the score is less than 2, we say it is, you don't have to do the follow. But if the score is 3 to 7, we have to give the follow up and chat. That form we have to again give, and we have to sit with the parents, and we have to solve those questions. Because if the score is more than 2, normally parents have written some, always, because we have to see yes or no, yes or no. So it's not always that parents will sometimes say, even though baby is doing no, sometimes he will do, then he will mark no. So we have to sit with the parents, and we have to do it properly. So total score more than 2, we have to always do that follow up MChat. And if the score is more than 8, then immediately we have to refer the baby for the diagnostic evaluation and early evaluation. The other thing we do, Trivandrum scale, which has different criterias, social criterias, communication criterias and all. So if at all, that also we score from 0 to 5, from no to yes, fairly always to that we score always from never to always 1 2 3 4. So and we score it according to the baby's social interaction, communication, behavioral characteristics, and sensory interaction. So all these things if we see, and we have to assess the baby. accordingly that. And the third one is social communication questionnaires. In that we have 40 questionnaires. Out of that also we have to sit it with the parents and we can answer those. So if at all, if you see that baby is falling into autistic criterias, please go to the nearby pediatrician, developmental pediatrician, because the treatment is not only the single doctor, but yes, it is multidisciplinary treatment. Developmental pediatrician, then we require some speech therapists, which require special educations people. We require occupational therapists, we require child psychologist, psychiatrist sometimes, and neurologic doctor also. So that is why it is a whole teamwork. So we have to go ahead and do this along with the parents. So it is not only the kid, we have to involve the not only the parents, the maybe more and more family people, because as much as we do in our center, we have to do it at home also, because if the efforts are done from the parent side and at the center also, the child's ability to improve is very very high. So I would like to discuss, I would like to request to the parent that please, anybody of whatever signs I have told you, if you are having any problem, please refer to your nearby pediatrician, or else I'm there every day. You can come back to Apollo Hospital. I'm ready to solve all your doubts regarding the baby, and we have variety of specialists also. So we would like to do the evaluation as early as possible. Thank you.